Thank you for joining us today. I'm Melissa Bryant, Senior Advisor to the Secretary of Veterans Affairs for Strategic Engagement. Welcome to the Department of Veterans Affairs Domestic Violence Awareness Month Facebook Live panel discussion. October is Domestic Violence Awareness Month. Here at VA, this month we heighten our awareness outreach to veterans, their family members, caregivers, and survivors. We want them to know that there are resources available to assist those who are encountering or have encountered intimate partner violence. You will hear more about those resources today from our panel. You will also see the domestic violence hotline number scrolling on the screen periodically during this panel discussion. The domestic violence hotline number is 1-800-799-7233 or 1-800-799-SAFE. You can also reach VA Intimate Partner Violence Assistance Program coordinators at www.socialwork.va.gov/IPV/coordinators.asp. We recognize that today's topic may be very difficult for some viewers. We have people standing by in the chat from the Veterans Crisis Line to provide resources. Or if you're experiencing a crisis, we encourage you to call the Veterans Crisis Line directly at 988 and then press 1 or text 838-255. Trained professionals are there around the clock and are available to provide support if you are having thoughts of suicide. This is a very important topic to me personally as a woman veteran, but also in my role as the co-chair to the Strategic Engagement Work Group under the VA Subcouncil on Sexual Harassment and Assault Survivor Care and Support. I have been an advocate in this space for many years, including being part of the core leadership of the grassroots movement for justice for Army Specialist Vanessa Guillen in 2020. And I've experienced the heartbreak of intimate partner violence with loved ones. To whomever needs to hear this, you are not alone. There is help out there. I'm here with leaders from the White Ribbon USA, the National Association of Social Workers, and the Department of Veterans Affairs. I will ask each of them to introduce themselves to you. Starting with Leanne.
Hello, I'm Leanne Bruce, and I'm the National Program Manager for the VA's Intimate Partner Violence Assistance Program. I'm trained as a clinical social worker, and throughout my career I have worked with children, adults, and families. And I've worked in military settings, community settings, and now with veterans. And one of the threads that run through all of those settings is the pervasiveness of domestic violence and intimate partner violence. Now it is my honor and my pleasure and my privilege to work with veterans and their partners and VA staff members who are impacted by intimate partner violence, and to help them to achieve safe and healthy relationships, which is this year's campaign for Domestic Violence Awareness Month. And I'm just very happy and honored to be here today.
Thank you, Leanne. Kimberly.
My name is Kimberly Willis. I'm a chaplain with the VA. I'm actually the Executive Director of the VA National Chaplain Service. I'm honored to really be here today with this distinguished panel, and excited to share the role of chaplain service within intimate partner violence. And when I think about intimate partner violence and all that, how it impacts people, one thing that we are really clear about, it changes the way that a person looks at themselves and the way that they look at the world around them. And so to be able to partner with these distinguished guests and with my chaplains out in the field who every day are working towards helping people to see themselves the way that they should see themselves and not through the skewed lens of IPV.
Thank you so much for that. Veronica.
Hello, my name is Veronica Mudra. I'm CEO and founder of the White Ribbon USA, and I'm a former CEO of White Ribbon in Ukraine. This subject is extremely important for me because I'm a domestic violence survivor myself, and I feel privileged that our nonprofit has a chance to spread awareness about domestic violence nationwide, and with such a great partnership with U.S. Department of VA and National Association of Social Workers, I believe we can do much more together by joint forces, and I really appreciate all my co-speakers being here today.
We are stronger together. Angelo.
Good afternoon. I'm Angelo McLean, Chief Executive Officer of the National Association of Social Workers. I've been a part of the domestic violence prevention community for many years, and in the last 15 years have been with an emphasis on helping folks who are in intimate relationships, experience safety and healthy relationships, and trying to do my part to end sexual assault, sexual harassment, and domestic violence.
Thank you. And then finally, Jennifer.
Thanks, Melissa. Hi, I'm Jennifer Kogut. I serve as the National Director of Social Work, Fisher House and Family Hospitality, and the Intimate Partner Violence Assistance Program in VA. I also serve as the co-chair for our White Ribbon VA initiative. And I just want to add that we have over 17,800 social workers across VA that stand ready and willing and able to serve those who may be experiencing intimate partner violence in any situation. We're here to help.
Thank you all, esteemed colleagues, for being with us today, and thank you for those introductions. Now, before we begin our discussion, we're going to share a short video that we hope demonstrates the importance of recognizing domestic violence. This is a powerful clip demonstrating resources available to those who experience intimate partner violence, either directly or indirectly. I want to caution you, the clip contains first-hand accounts of intimate partner violence and may be upsetting for some.
Sergeant Tiffany Ojeda Hill was a Marine Corps veteran, mother, daughter, sister, aunt, and dear friend of mine who was fatally shot through the windshield and driver's side window. She was shot multiple times in front of her mother and her 3 young children while they were parked in front of the kids' school. Her killer was her estranged husband.
I joined the Navy at 17 years old in 1988, and I spent 10 months on board a ship being sexually assaulted, hazed, beaten, and dealing with so many mental health issues that when I got out of the Navy, I was in a downhill spiral. It took me over 20 years to be able to have the courage to reach out and get any type of help. And within that 20 years, I was in and out of relationships where I was the one that was being violated with domestic violence.
As a reminder, if you need to talk with someone about intimate partner violence or intimate partner violence situation, please either call the domestic violence hotline or please call your VA local medical center and ask to be connected with an intimate partner violence assistance program coordinator. If you find yourself in crisis, please do not hesitate to call the Veterans Crisis Line directly at 988 and then press 1 or text 838-255. Now let's get to our panel. Leanne, can you please define for us what is domestic violence and intimate partner violence?
Thank you for that question. The VA actually has one of the broadest definitions of intimate partner violence and recognizes domestic violence. We recognize domestic violence as any kind of violence that happens in the domestic sphere, in the home, which could include child abuse, elder abuse, neglect, dependency, and things like that. And as social workers and medical professionals, we are there to help mitigate those risks as well. But our program, and what we're here to talk about today, is specific to intimate partner violence, the violence that occurs in many different types between 2 adult partners. And as the video mentioned, it can happen to anyone. It really knows no color or age. It really can happen to heterosexual or same-sex relationships. It does not require that people live together, have children together, or even that they have a sexually intimate relationship. So it's very broad to think about the definition about intimate partner violence. And again, there's just so many types of violence that we recognize, not just the physical.
And Veronica, what are some of those levels of violence that Leanne is alluding to?
Domestic violence is not just a physical act. Violence can be on so many levels: emotional, verbal, psychological abuse, financial, and even administrative. And one more important type and classification is cyberbullying, and it became especially important during pandemic. And I want to remind the audience about the reauthorization of the Violence Against Women Act that happened this March when President Biden signed into the law the Violence Against Women Act. And it's a bipartisan legislation. So it included cyber bullying as a type of domestic violence and a type of cyber crimes that became, unfortunately, very widespread during pandemic. So I want everyone to remember about it, and that there are a lot of types of the violence, and it's not just physical act.
Thank you so much for those definitions, ladies, and especially for speaking to the reauthorization of the Violence Against Women Act, which has been in law for over 25 years, I believe. For Angelo and Jennifer, reflecting on the video clip, is there help for people or for persons who are indirectly affected by intimate partner violence, like family members or friends, co-workers, similar to Rosie's experience described in the video?
So that's a great question, Melissa. And I think that there are many resources, not only internal to VA, but external in the general community, available to help support those who may experience intimate partner violence, but also indirectly impacted by intimate partner violence. So resources for families, for children, for others who may live in a home where there is intimate partner violence occurring, or previously lived in a home where there is intimate partner violence or was intimate partner violence. In terms of the resources available and the crisis resources that Melissa had mentioned earlier, we also have so many ways to be able to outreach to individuals who may be in these types of situations. That can be through primary care providers. It could be through social workers, nurses, many healthcare professionals that are available to provide support and assistance to anyone of any age who may be impacted by intimate partner violence.
Yeah, I want to go back to that last question about the definitions, and just sort of, as you guys pointed out, all the different forms of domestic violence and intimate partner violence and abusive behavior. Is, it's all aimed at controlling, manipulating, having power over another person, and oftentimes it's part of the intervention is people learning how to not have power over someone, but to be able to share power in their relationships.
Yes, and can you tell me more about any resources that are available through the National Association of Social Workers for those who experience intimate partner violence, Angelo? Well,
at the National Association of Social Workers, we actually provide resources for social workers who are working in the field with families and communities, in making sure that social workers have the skills, the competence, and the resources available to intervene, because social workers, whether they're working with children and families, working in school social work, hospital social work, forensic social work, any variety of settings, will encounter situations of intimate partner violence, and so they can have the tools to make those assessments, make interventions, and then make appropriate referrals.
Wonderful. And Kim, if you could please talk to us a bit about the VA Chaplain Service and what services are available.
So within chaplaincy, first of all, chaplains are one of those known agents, those known entities for our military members as they transition into the VA setting. And what we offer is an opportunity for them and or their partners, however they identify that person, to have opportunities for psychoeducational groups, individual, as well as individual counseling and things of that nature. We offer things such as our Warrior Soulmate program, which is an amazing program because hopefully it provides an opportunity for people to develop better communication skills, which oftentimes we see when communication breakdown. We also see an uptick of what happens as it relates to intimate partner violence. So there's a large gamut of opportunities for our veterans and their loved ones to participate. What we do hope is that when they do come to see us, that not only do we provide services that deal with their spiritual care, but we also become a referral source for our social work and our mental health partners as well. And so it's a wonderful community of care providers that ensures that they get what they need.
Thank you so much. And do you have to belong to any particular faith or religion in order to seek services from counseling or from a VA chaplain?
Absolutely not. What's important is what you defined as your spiritual resource. And so our job, my job as a chaplain, is to come alongside you and help you to identify that, to be able to actually take those tools within your spiritual resource bank and to utilize them so that you can move towards whole health and well-being and living in a way that is conducive to flourishing, human flourishing. And so that's what we try to do, and it does not matter at all if you have a faith belief or not, a spiritual construct or not. We will walk with you every step of the way as you begin to understand yourself in the spiritual capacity.
That is absolutely uplifting to hear. Veronica, can you tell us more about the White Ribbon campaign, these white ribbons that we're wearing on our lapels? Can you tell us about that and how it addresses domestic violence?
Of course. Thank you for the question. I'm sure a lot of veterans wonder why there is a white ribbon and what is white ribbon. So White Ribbon Campaign has an interesting history and legacy and background around the world. It's the largest in the world male initiative against domestic violence towards women. It was founded in 1991 in Toronto, in Canada, as a male response to domestic violence towards women. And White Ribbon is actually a piece of white paper. So 3 men gathered, they're all professors, and they said what we can do to address violence, domestic violence towards women. And they had a white paper on a table. So one of them took a piece of paper and put it as a sign of his personal pledge to never commit, excuse, or remain silent about violence towards women. While partnering with law enforcement, with DOJ, or with VA, we made the pledge genderless in order to address that domestic violence is truly genderless issue. So we tailored the pledge and made it really addressing domestic violence towards others. So White Ribbon is a grassroots campaign, it's decentralized, and it became very popular over the past 30 years. So we have more than 83 offices around the world. And me, myself, I was attached first to the White Ribbon office in Ukraine, and I moved here as a refugee, and I'm now managing White Ribbon on federal level. So it's really, anyone can be involved on any level. We're welcoming new White Ribbons, new chapters on local levels. So it's very approachable campaign, and it's truly genderless, and we welcome anyone to join us.
Yeah, I can remember when I first took the pledge, in 2008, I pledged to wear the ribbon. I took the pledge, and I also committed to talking to 5 other men to take the pledge. And I can say I fulfilled that. I did talk to many more than 5 men to take the pledge, and I'm so glad that I learned about the White Ribbon because it's such an important tool.
I think you far exceeded your pledge, Angela, and we appreciate that. And Here at VA, we take the pledge. Everyone who is sworn in to come into service at VA, we raise our hands and we take that pledge as well. And so it's such an important movement that has really grown. Jennifer, can you tell us more about White Ribbon VA?
Sure, and you know, our engagement in White Ribbon VA really started with a conversation between Dr. McLean and Veronica, and bringing White Ribbon USA to VA's attention. And that happened back in 2021. And out of those conversations, VA decided to partner with National Association of Social Workers and White Ribbon USA to establish and promote White Ribbon VA. And within VA, White Ribbon VA is our national call to action to prevent and eliminate sexual harassment, sexual assault, and domestic violence. The White Ribbon VA campaign encourages not only our veterans, but our staff, family members, caregivers, support persons, survivors, really anyone who engages in the VA community to take the pledge to stop violence against others, regardless of gender. Within the Department of Veterans Affairs, we are truly committed to ensuring that we have a safe community, and it's a welcoming place for all, that is free from harassment, and a place where everyone feels that they can come in and they can be together and not have to worry about experiencing any type of harassment, assault, or violence. As you mentioned, we have staff all over the country at all of our medical centers who are actively engaged in White Ribbon VA, and thank you for, again, bringing White Ribbon to VA's attention, because it's truly made a significant difference in the culture of our organization, and also in the culture of the partnerships that we have with those in the community.
And I want to add that I want to emphasize that White Ribbon is an awareness-based campaign, and we really do sustainable, long-term strategic work, so the victims will not be ashamed to seek help, to be vocal about the abuse, and use all these great resources that were developed within VA, within the National Association of Social Workers. And so we just really advocate against any taboos existing around gender-based and domestic violence.
Yeah, and that's a great point. And I think, you know, in VA, the one thing that we really ensure is that anyone who enters our doors knows that we want them to speak up. If you see something, if you see harassment or assault, or something that you think is really an unfair practice or something against another person, please tell someone. You know, please engage a VA staff member so that we can get involved and we can help. I think that's really important.
Yeah, that's so exciting to see how you're using this prevention method to build a culture where people feel safe and feel respected and feel that they can speak up. And it's so, from where I sit, just really amazing to see, you know, that how you're using that to transform your culture.
And you're absolutely right in talking about that culture, because it's set from the top. You know, the secretary took the pledge, the deputy secretary took the pledge, and the chief of staff. And so when you see that culture starting from the top and really proliferating throughout all of our VA medical centers, our community-based outpatient clinics, our regional offices for benefits, et cetera, our cemeteries, there are so many ways in which it proliferates into the community then at that point, when you show that this is genderless, that it is biasless in terms of how we really do embody the values of the White Ribbon Pledge. How has the pandemic affected those with domestic violence? Veronica, I think you have a unique take on that from the perspective of White Ribbon, but would love to hear from Leanne and others on that too.
Absolutely. Since we started our collaboration with VA in 2019 during the pandemic, we learned a lot as a nonprofit how to transfer to the virtual space. So we came up with the concept of virtual white ribbon pledge and virtual white ribbon badges that we can deliver nationwide to larger categories of people. And since we learned how to navigate in virtual space, we learned that such tools like artificial intelligence as virtual reality can be an amazing helpful tools for distance diagnosis, for therapy in a virtual space, and that can reach out to a larger amount of those in need of survivors and victims. And we learned that such simple tools as mobile application can be actually helpful during pandemic to survivors to seek help, to navigate the resources existing. So we work on developing the White Ribbon mobile application accessible to anyone from anywhere at any moment. So I think that is a great experience, challenging, but I think that it's very beneficial nowadays, since we can deliver our message easily through virtual space to a larger amount of people across the country.
Absolutely, that gave us an opportunity too in responding to the pandemic. We had to think very quickly about how we can reach those who may be out there at risk. And so every VA has an Intimate Partner Violence Assistance Program coordinator who's organizing and coordinating resources and training, and out in the community training providers. And they had to mobilize very quickly, realizing that this pandemic and people being home more, having less resources, having less supports, those who were at risk were at even more risk in a lot of ways. And how do we reach them, and how do we reach them safely? Realizing that we already had a very robust program of telehealth, but this just really broke that open. But we had to really train providers on what to look for, signs to see, how to ask questions if they felt like someone might be at risk, how to have those conversations in discreet ways. We're still improving some of those methodologies, as you know, to this day, but we really learned a lot very quickly too, and mobilized very quickly to try to reach out and make sure that we had systems in place through our telehealth capabilities, and that providers and staff members and anyone who was reaching out were trained to do that in a really discreet and sensitive way.
Well, it's not surprising to hear the spirit of adapt and overcome coming from a military and veterans community, but really pulling together during the pandemic. I'm sure that it has really paid dividends and made such a difference in the lives of many of those who've experienced intimate partner violence. I guess my question then back to Leanne, and then if really for anyone, is there assistance available to those who actually engage in intimate partner violence, those who may be the aggressors?
Thank you, Melissa, for asking that, because we're really a very unique and comprehensive program, because not only do we serve those who are experiencing intimate partner violence, we also serve those who are using or might feel that they're at risk of using intimate partner violence, those who are seeing signs in their own relationship and behavior that they don't like. They want to have healthy relationships, and we have a wonderful evidence-based program that was developed for veterans called Strength at Home. And so we not only have evidence-based programs for those who experience intimate partner violence, we have those groups for those who use intimate partner violence as well. And again, in the learning curve, we're realizing that in some cases where we have veterans who are in one part of the country who need some of those groups, we actually can refer across programs and across facilities, and that's what's happening now, to be more accessible to the veterans who need those programs.
That's fantastic. And what should a person do if they witness domestic violence? For Angelo, or really for any of our panelists?
Really, you know, we say it a lot. If you hear something, say something, do something. But really, to just understand that if you're seeing intimate partner violence or hearing about it, that it's serious, and it could end in death. It could end in, you know, long physical injuries. It impacts children who witness it. So it's inherent on those of us who see it to take action, because if we don't, it's almost as if we're condoning it. It's almost as if it's okay. and that's some of the work we've done with men, is to really say, you know, sometimes when you're laughing at a statement that's disrespectful to women, if you're laughing at jokes, or if you're just kind of looking the other way, you know, this notion of boys will be boys, that's not acceptable. So in the more that each of us take responsibility to step up and say something and do something, it changes our culture within our society, and it gives people who might be abusers less space to do that.
Absolutely.
Those are great points, and I think also it's important to note that, you know, even seeing something subtle, you know, just a small amount of control over someone else's behavior, over their access to money, over their schedule. I think it's important to reach out and say, hey, are you okay? You know, what can I do? I just want to check on you. And I think those are the conversations that are really important in terms of raising awareness, in addition to interventions and resources, but just encouraging everyone to check on others when there's a concern or they see something concerning.
Yeah. And we really want to normalize within our society, in our communities, that checking on each other is fine. You're not getting into someone's business or anything. It's all of our business, but just to say, hey, I'm part of your network, your safety network, and are you okay? Because I'd want you to do the same thing for me if you saw something.
Absolutely.
It's very long-term work, and sometimes it takes generation to embed the new culture, because speaking about witnessing domestic violence, children are often called silent victims of domestic violence because they're witnessing what's happening in households, and when they grow up they tend to be often or abusers or victims, unfortunately, unless they're having a therapy and addressing these issues. And that's where campaigns like White Ribbon stepping in to change the culture. Again, it's a lifelong, it's a long-term process, but when young boys have great role models who's speaking up against violence towards women. So this is the best early prevention of domestic violence in grown-up life, and it's the best tool to change the culture of unacceptance of violence in any form or shape.
And I would just add, for any of the viewers who are worried about someone, that can be traumatic too, to be worried about a family member or a friend, just like from the video that we watched earlier. And if you're not sure how to have those conversations, which are so important and so crucial, is getting information from the White Ribbon Association, the National Domestic Violence Hotline. Call one of the VA's Intimate Partner Violence Coordinators. They would be happy to give you resources and help you know how best to have that conversation and maybe be a sounding board. And in some cases, people who are witnessing need help too. So, and just don't hesitate or be ashamed to reach out to someone and get some information.
Thank you all for covering that. That's so many ways in which you can engage in this issue, and I'm so glad that all of you really address the multifaceted nature of the lifelong trauma that can be experienced by the aggressor, by a family member, by the intimate partner themselves, by really everyone who is affected by this. And it's one of the reasons why I think from the military side of the veteran space, when, before we take off the uniform, we're familiar with the Family Support Center at bases and stations. We're familiar with knowing where to go to talk about some of these things when we don't know where to start the conversation. Can you talk to us a bit about how you transitioned from the military, where many of us know to go to, the chaplain, for example, like Kim, and then how do you transition from there over to VA services? So for Kim and for Jennifer, if you want to talk to me a bit about that.
Okay, sure.
Yeah, so I think that, when we have active duty military that are transitioning to veteran status, we do a lot of education about resources and the programming that's available in VA. And the one thing we want to ensure is that when we identify an individual who may be experiencing intimate partner violence, whether it's the service member or a family member, we want to ensure that we connect them with our Intimate Partner Violence Assistance Program in VA. That's a really important next step so that they have the resources and the interventions that they need, really as they're enrolling in VA for care. And I think we make those warm handoffs early through our transition and case management programs, but they're really important because we want to ensure that our service members know that we have them when they transition over to VA. If they're experiencing these situations, we have them, and we're here for them, and we can help them immediately.
I would say that, and I think I alluded to this earlier, that chaplains is one of those consistent forces, whether it's in the military setting or the VA setting. And so when a service member transitions over to the VA, when they're introduced or made known or made aware of that there's a chaplain that exists, there's certain expectations that come along with that. And one of those is knowing that you're in a safe space, a space where you're going to be heard. And more importantly, especially when we're talking about intimate partner violence, is that you can have voice. I think one of the things that happens when people are suffering from intimate partner violence, whether they are the person who is experiencing it or the person who is on the other side of that, is that voice gets diminished, voice gets silenced. And so being able to come to a chaplain, which is a familiar space, and have some ready trust already built into the experience, gives an opportunity to give voice that I've been doing this, I've been thinking about this, these are the things that I'm worried about, or this is what has been happening to me, and recognizing and hoping that the chaplain then would take that information, hold it in the way that it needs to be held, and then disseminate it to the other care providers that could come alongside to give that veteran what he or she needs in that space.
That is so, everything about that is just so caring and so uplifting, and knowing that those supportive services are available through chaplains. And again, I think it's worth reminding our audience that you do not need to have a religious affiliation in order to see the chaplain. And a lot of us from the military, we understand that, and in accessing the chaplain services, that it is free of denomination, free of really any religious affiliation when you need to seek those services. Something you said, Kim, triggered for me the thought back to what Leanne brought up, and that's the Strength at Home program and supporting the family. Strength at Home supports couples, right? Can you talk to us about that?
I can jump in,
Yeah.
and then we can differentiate.
Yeah.
So the Strength at Home program started out as a veterans group and a veterans intervention for those who use intimate partner violence, in some cases those who have been involved in the court system, all the way to those who just recognize that they want to learn the skills to have better relationships, and they have started a couples component of that. But there is another program that's run through the chaplains program, the chaplains services, that is absolutely phenomenal as well. And I'll let Kimberly talk about that, because we refer there too to really strengthen couples.
Yeah. So that program, I spoke to it earlier, is the Warrior to Soulmate program. And the Warrior to Soulmate program is a program that started in the early 2000s, and it started with a joint initiative funding grant in partnership with DoD and VA. And over the years, we partnered with social work to really expand it across the nation. And it's an amazing program that allows couples to come together in what we call a retreat environment typically, and begin to discuss and discover their communication style, better ways to communicate their, what we call our emotional allergies, those things that give us triggers, and we respond in old patterns of behavior, and begin to figure out different ways to respond to those allergies, if you will. And that program, we hope that a veteran is able to participate in prior to the occasion of intimate partner violence. But even if that couple is experiencing intimate partner violence, it is one of the many tools that we have to help begin to turn things around, for them to be able to communicate better, to understand where the other is, how they experience and see the world. And so it's a really amazing program that we offer throughout the VA.
And if I could add,
Yeah.
one of the things that we see so much of it in the VA with couples, veterans, and their partners is that they really want to have healthy relationships.
Yeah.
But when you think about the experience of multiple deployments, being separated so much, maintaining intimacy and trust and communication and problem solving is not easy. It's not easy in a lot of relationships, and so we agree that one of the best ways of intervention is prevention and getting involved early, helping people learn those skills through all of the different programs that we have, and our partners in the community that we refer to really helps couples achieve those self-healthy relationships that they're striving for.
I love that. It sounds like the theme here is to normalize mental health is health, and the many ways in which VA, but also national organizations like the National Association for Social Work and White Ribbon USA as an advocacy and awareness campaign, tuning into those things can really help bring out where those supportive services are, how you can access those resources, and making sure that veterans, our families, caregivers, and survivors are able to really support that whole health as we talk about here at VA. We have about 10 minutes left in our session. I want to make sure that I query the audience. If there are any questions in the chat, please do drop those. We're more than happy to answer your questions here while we have the panel. But I guess I'll take this opportunity to first go back to the panel and to see if there's anything that we have not addressed yet. I'll first go to Veronica to see if there's anything from White Ribbon USA, particularly interested to hear if there are things that have going back to the theme of the pandemic and things that you have noticed coming up across the country and around the world globally, any trends or any resolution to trends that you think we should talk about here in ways in which White Ribbon and the awareness raised through the White Ribbon campaign that can help our viewers here?
I want to use this opportunity to appeal to audience. Those who are watching us to go online on whiteribbonusa.org website, and I believe you're going to see a QR code on a screen at some point, and take this White Ribbon virtual pledge. It's a small and sometimes we think it's insignificant step, but this is an important personal dedication to address this issue with your family, with your neighbors, with your friends. And this is what White Ribbon is all about. We're totally grassroots, available for everyone. And we are the first in the world White Ribbon office that developed that unique and simple virtual tool. And also I want to address the couple therapy importance of this program. Not just for veterans, for everyone, because we are coming to relationship often from different backgrounds. And we can love our partner, but sometimes we might not have needed tools and knowledge how to better address some communication issues and some family conflicts. So in order for family conflict not to grow to a domestic violence or, God forbid, to a crime, I think the early treatment and the couple therapy is great tool. So Kim, you do an amazing work, and addressing this prevention is so important. So very grateful as a domestic violence survivor myself. I'm really grateful. This is a very important program, and I want to say that those of you who experience some problems with your relationship in household, do not be ashamed to address it on early stages and use these amazing tools available within these organizations who can give you services needed to save your families, to save your relationships, and made your household more healthy.
Wow. Thank you so much, Veronica. Your perspective is invaluable, particularly the piece where you're talking about coming to this issue set from different backgrounds, from different places and perspectives in life. That's really something to keep in mind as we think of how do we address this on a global scale. Angelo, I think I have a similar question for you in terms of how the National Association of Social Work can help promote this relationship health and safety.
Yeah, before I answer that, I was just thinking back, I'm not military, I'm not a veteran. I wish I were, but you know, what I've learned from my colleagues at the VA and active military folks I've talked to, you know, the sense of duty, the sense of honor, the sense of respect, sense of dignity, and it's sort of, it's a duty and an honor to respect people, and that just really, you know, I was at Hanscom Air Force Base and was participating in an event like that, and it just really stuck with me. That was 10 years ago, but just the sense of there's an honor and a duty there. So I just wanted to underscore that. You know, one of the things that we do at NESW to kind of amplify these messages, you know, there's over 750,000 social workers, and social workers have to get continuing education credits and get licensed. There's over 500,000 licensed social workers in the U.S. So through those educational opportunities, those continuing education opportunities, we get the word out. We also have on our websites for social workers tools, sort of the role of social workers in responding to intimate partner violence, toolkits that can help social workers do local campaigns. Then we have tools that help social workers in terms of opportunities they may have in terms of domestic violence legislation. You know, we talked about the passage of the Violence Against Women's Act. You know, social workers were actively involved in the advocacy there. Then we also have a website that's a little less well known, but it's called Help Starts Here, helpstartshere.org, and that's where we have resources for the general public. And on helpstartshere.org, we do have resources, intimate partner and domestic violence resources posted there. And among those is information on how to locate a clinician in your neighborhood.
That's wonderful. Thank you so much, especially for pointing us towards how to find those within your neighborhood, because while we are talking veterans and military families here in our forum today, recognizing that this is broadcasting on the NASW Facebook page, and so we recognize that there are many of you who support our community, but who are also living within the communities at home and making sure that we are all promoting a safe and viable way of living. If you've pledged 2 years ago, do you repledge every year? Because you mentioned 2008, Angelo, and that you attended a ceremony at Hansen Air Force Base. And then also I'm thinking, Jennifer, you know, as you're talking through the work within White Ribbon VA, do you repledge every year?
I do repledge every year, and I think that along with repledging is equally important raising awareness. So when people ask, what is this white ribbon? Why are you wearing this? Really taking the time to explain why it's so important, and then encouraging those who ask, and even those who don't ask, when I explain what it is, to tell other people, tell others what this means, encourage them to take the pledge. So not only do I repledge and reaffirm my commitment to safety for all, but I also encourage others to do the same through that work.
And I want to add that as a repledging way, there is a International White Ribbon Day that we are trying to establish actually from this year in the U.S. together with National Association of Social Workers and VA. So it's an annual day when you remember to not just repledge, but maybe to engage more people in this movement. And by going viral, by addressing this issue, we make a progress on a bigger scale for our communities, for our families, for our friends and neighbors. So just jointly creating this movement, this is the beauty of grassroots campaigns. That's why I'm a strong believer in what I'm doing.
Yeah, for me, I love the pledge, because you know, the pledge I took, and they're a little bit different, but the one I took that's in my brain forever is, you know, from this day forward, I promise to be part of the solution. And so I do take that pledge, you know, periodically, you know, and just re-upping that from this day forward, because, you know, I could have done some really great things 5 or 10 years ago, but what have you done lately? And are you still putting the word out there, trying to help change the culture within our society. And when I ask myself that question, I want to be able to say yes.
That's a great point. Changing the culture, and that's what White Ribbon USA, White Ribbon VA. That's what it does. Changes the culture, so that it, we have in the forefront. No matter where we go, I want to check on others. I want to make sure they're safe, and know that there are resources for those who need help, and be able to point them in that direction.
I think the White Ribbon, from the time Angela brought it to our attention, has been a symbol that we've all been able to mobilize behind with that program. It just really spoke to what we wanted to embrace as well. So it just gives us that symbol that we've just mobilized and are starting to change the culture.
And any final remarks for any of you all, and anything that you really want to communicate that we haven't touched on already? We've already given a wealth of information, and I'm going to close with more resources before we leave our group, but I do want to make sure that we give space for everyone to be able to address those issues near and dear to their heart. And so I'll go around the table for any final words, starting with Leanne.
Well, I know you're going to give our website again, but I do encourage people to go to our VA Social Work IPV website. There's tons of resources there if you just want to explore. There's some self-assessment kind of questions to assess your own relationship. Is it healthy, maybe a little unhealthy, maybe at risk? And some resources there. There's a safety planning guide. There's our directory that will lead you to your Intimate Partner Violence Assistance Program coordinators in your local area. So I just want to just re-emphasize that, and to just reiterate again how proud I am to be doing this work to help our veterans and their families with that very fundamental need of having that other person in your life and that being healthy. It's such a protective factor against so many of the other things that we see and that we worry about with our veterans. So if that's something that we can do to help our veterans, it's just my honor and privilege to be able to help others in our system do that.
And Kimberly, any final thoughts from you?
Yeah, a couple of things. I want to just emphasize that we have chaplains at every VA medical center. And so if you have any questions specific to what services chaplains might offer at that particular facility that is closest to you, please give them a call. They are waiting and ready to be of service in any way that they can. I also want to emphasize that this takes community work. It takes community for someone to feel safe enough to talk about what's happening. It takes community to develop resources for those individuals. It takes community for everybody to execute whatever needs to happen. And so if we do this in community, and I think this is why White Ribbon is working so well, is that it has become community. You can't change a culture in isolation. You have to do that in community. And so all of us coming alongside, and whether we do the pledge once a year or biannually, but remembering that if we do this work as a collective, we can definitely change the tide. And people's lives will not just be changed, but they will most definitely be saved. And so we just remembering that this is a community experience.
Thank you. Veronica.
I want to explain also a little bit the concept of White Ribbon VA. We ideally wanted to create a movement that is supported on local levels, on state levels, by local VAs, and I want to address this to veterans, that U.S. Department of VA is such a powerful, large organization that works on federal level. So we want to encourage local White Ribbon leadership, and I hope that with time we can build a structure of local leaderships, as we have, for example, White Ribbon clubs in universities and educational facilities. We would love to see White Ribbon leaders on state, local levels. That will enable to create a larger, more viral movement, and we can address a larger audience all together by joining forces. So I think working together on state levels and welcoming local leaders, local leadership is very important.
Thank you so much. And Angelo, please.
My thoughts are about power and control, and that encourage people to not have power over your intimate partner, but to have power with. Learn ways to share power, and because those, it's too much of a burden on any of us to have power over someone, and it's actually a joy to share power with someone, because you're doing it together, you're doing it in partnership, and you just feel better about yourself and your relationship. So I just want to underscore that. I know that it's easier said than done, but the help is there to do the work, so you can learn how to share power.
And then final thought to Jennifer.
I think my final thought is saving lives. This movement saves lives. Awareness saves lives. Asking questions, checking on others, it saves lives. And I think if you can take any piece of this forward today, please know that if you're in an unsafe situation or you have concerns about your situation, we're here. We're here for you in VA. We're here for you in the community through multiple outlets. But please know that we want to help, and don't be concerned about asking someone or intruding on their privacy if you have a concern about them. I think checking on each other is what we need to do. It's what we have to do in order to save lives.
Power, community, relationship health, mental health is health. So many wonderful themes that came out of this conversation today. I want to thank all of our panelists for contributing to today's discussion. And I'd like to thank our audience for joining us today. Remember, you do not have to suffer alone. There is help available to you. If you are involved in intimate partner violence or would like more information about services, please contact the local Intimate Partner Violence Assistance Program coordinator at the closest VA medical facility, or please call the Domestic Violence Hotline at 1-800-799-SAFE 7233. As always, if you find yourself in crisis, please do not hesitate to call the Veterans Crisis Line at 988 and then press 1, or text 838-255. You can reach our VA Intimate Partner Violence Assistance Program coordinators at www.socialwork.va.gov/IPV/coordinators.asp. And if you have not already, please consider taking the VA White Ribbon Pledge to never commit, excuse, or stay silent about sexual harassment, sexual assault, or domestic violence against others. And you can document your commitment at whiteribbon.usa.org/whiteribbon-va-pledge. Thank you again to everyone who has joined us this afternoon. I've learned a lot. I hope you have as well. You are not alone. There is community. There is help. Thank you all for being with us today.